So another question that I get all the time is, well, how do I diagnose GERD? I like to break it down. There's subjective and objective ways to diagnose GERD. Subjective is we're going to sit together. We're going to have a consultation. And actually, by the way, we do televisits. So on a televisit, I can pretty much tell if you truly have GERD or not by getting a very detailed history. But we call that subjective because you're talking about your symptoms. I'm analyzing with my experience and your experience in GERD as a patient. We put it together and we say, looks like you have GERD, but I'm not 100% sure. So that's the first step. Objective is we actually have data. We have things that show that you might have GERD. Now, we can say that the gold standard, what is the best way to diagnose GERD today, is what we call endoscopy. Endoscopy, or you may have heard of EGD, which is fancy. It's a 3-letter word, but it stands for esophagogastroduodenoscopy. This is where, under sedation, we insert a camera through the mouth and into the esophagus and into the stomach, and this gives us, by far, the most information that we need to diagnose heartburn. When we do that test, it's still not 100%. There's another test that we can do at the same time, and it's called an acid reflux test. You may have heard it called by the Demister score, the Bravo score. It's a very easy, nice test, and it's done at the same time as the endoscopy. And we insert a very tiny microchip, a tiny sensor, just above the stomach. And we leave it for 4 days. And by the way, a question I get all the time, what happens to it? It's going to fall and it's going to disintegrate and it will be gone. Not a single patient will ever feel it. And you go home with a small monitor that is wireless, by the way, it's not attached to you, and it will record every time you have an acid reflux episode. And every time that you feel you have symptoms, you write down, I was having tea, or I was having a small donut, and then we can correlate your symptoms with the recording of the acid reflux. I will tell you, there's patients once in a while that I see that I'm not sure they have heartburn, and they're on medications, and they're convinced they have heartburn. Their doctor is convinced they have heartburn. We do this test, and with the findings of the acid test, we confirm that the patient doesn't have heartburn because it's very, very accurate. So that is the gold standard, the endoscopy with the acid test with the Bravo study. Other tests that have been done, not as accurate, but they give an idea, is a barium swallow or an upper GI, and they give you some contrast to drink. You drink it, and they do a video, and they watch it go down, and if they see that liquid go down and go up, we call that reflux. Other things that can be done also is a CT scan or an MRI. As we go down the list, the sensitivity of these tests also goes down. So they're not as accurate, but they have been done before. But if you want to go for the gold standard, the very accurate test, it is an endoscopy done by the right person. It has to be done by a heartburn specialist who's looking for the right findings to correlate with your symptoms, and then doing an acid test would be the best way.